All right, buckle up, everyone, because today's deep dive is taking us all the way to Ladakh.
Ladakh.
This region in India where the Himalayas are basically the gatekeepers of healthcare.
Yeah, it's amazing how in Ladakh, the mountains and the extreme weather, they're not just a backdrop. They're practically medical conditions in themselves.
Yeah.
We've got a whole stack of research and articles.
Right.
And what's clear is that providing health care there, it's not as simple as just having doctors and hospitals.
Right.
It's this constant battle against the elements.
It's like a whole other layer of obstacles to overcome.
Yeah, absolutely.
Okay, so Ladakh became a union territory of India back in 2019.
Right.
For our listeners who might not know, it's kind of like a state, but with a bit more direct control from the central government.
Yeah.
So what's the healthcare situation been like since then?
Well, the government has been really pushing to modernize things.
Okay.
Like, think new hospitals, upgraded clinics, even telemedicine, connecting these really remote villages to specialists in big cities.
So I'm looking through our sources here, and
Yeah.
the two big names that keep popping up are the S&M Hospital in Leh
Right.
and the District Hospital in Kargil.
Yeah.
Those are like the main hubs, right?
Exactly.
Like, you have a serious medical issue, that's where you need to get to.
Yeah, they're equipped to handle the most serious cases, for sure.
But to reach them,
Oh, absolutely.
you might have to travel through some, like, really intense terrain.
You're talking treacherous mountains,
Oh.
winding roads, all of that.
And for anything super specialized,
Yeah.
like, I don't know, heart surgery, neurosurgery, things like that.
Right, those highly specialized procedures.
It sounds like people often have to travel outside of Ladakh altogether.
Yeah, often to places like Delhi or even Chandigarh.
I can't even imagine trying to get to a hospital
Yeah.
when the roads are blocked by snow for months at a time.
Oh, it's a major issue during the winter.
Which, according to these reports, happens pretty regularly.
Oh, yeah, it's not uncommon at all.
Okay, so we've talked about these major hospitals.
Right.
But what about everyday healthcare?
Yeah.
What about, like the villages
Mhm.
that are basically cut off from the rest of the world
Yeah.
for, big chunks of the year?
Well, that's where those primary health centers come in.
Okay.
They've been working on upgrading these centers,
Yeah.
trying to make healthcare more accessible in these villages all across Ladakh.
So they're kind of building up this network of local clinics.
Exactly. That's the idea.
Makes sense.
It's about bringing healthcare closer to people who need it.
But what about the money side of things?
Yeah, the financial aspect,
Because healthcare, especially in a place like Ladakh,
especially there. Yeah.
I can't be cheap.
Well, that's where they've introduced this program called the Ayushman Bharat Sehat scheme.
Correct.
It's essentially a free health insurance program.
Free.
Free. And get this,
Okay.
it covers every single resident of Ladakh.
Wait, every single resident?
Every single one.
That's huge. What does it actually cover? Like, what are the specifics?
It provides up to 5 lakh, which is about $6,300 US per family
Okay.
every year
Per year.
for medical expenses.
Wow.
And here's the interesting part.
Okay.
It covers treatment at some private hospitals, too.
So it's not just about providing a safety net.
Right.
It's actually almost encouraging the growth of private healthcare in the region.
Yes, trying to stimulate that sector.
Which is huge, especially with the limitations of
Yeah.
the public system in such a remote area.
Absolutely. Because attracting doctors to work in these harsh conditions, that's a challenge in itself.
Right.
So by giving people more options, including private care, it's a smart move, I think.
Definitely.
It's expanding their choices.
I'm seeing a lot in these articles about telemedicine.
Oh, telemedicine, yeah.
Is it really as big of a deal as they're making it sound?
Oh, absolutely. It's been like a game changer, especially for those remote villages.
Okay.
Imagine
Yeah.
a shepherd, right? Miles from any major town.
Yeah.
Suddenly, they're able to consult with a dermatologist in Delhi, let's say,
Wow.
about some, persistent skin condition,
Yeah.
all through a video call.
Right.
That's the power of telemedicine.
That's incredible.
It is. It is.
But I can't help but think, what happens if the internet goes down?
That's a good point.
We were talking about some seriously remote places here.
Yeah, reliability is definitely a factor.
Yeah.
But even with those limitations, telemedicine is still expanding access to specialists
Right.
in a way that was just unimaginable a few years ago.
Okay, so that's telemedicine. I'm also seeing mentions of air ambulances.
Oh, yeah, air
Is
ambulances.
that a common thing in Ladakh?
More common than you might think, unfortunately.
Oh, wow.
When roads are impassable,
Right.
sometimes the only way to get someone to a hospital is by helicopter.
It's like something out of a medical drama.
It is, but with very real stakes,
Yeah.
The Indian Air Force and the UT administration, they've been really crucial in providing these air ambulance services.
It sounds like they're really pulling out all the stops
They are.
to make healthcare accessible.
Yeah, they're trying their best.
But even with all these initiatives,
Mm-hmm.
there've got to be some serious challenges, right?
Definitely. And we're not just talking about typical healthcare hurdles.
Right.
We're talking about challenges that are uniquely Ladakhi,
Okay, well, let's unpack some of those.
All right, let's do it.
The climate, obviously, is a big one.
Huge.
I mean, I saw in one report it can get down to negative 30 degrees Celsius.
That's colder than my freezer.
Oh, absolutely.
And that's not even considering the wind chill,
Right. Yeah.
Many of these villages are completely cut off by road for a good chunk of the year.
Wow.
Sometimes like 4 or 5 months at a time.
Yeah. And if you need medical attention during those months,
It
it could be life or death.
can be. It really can be.
So even with all this technological advancement that we've been talking about,
Right. The telemedicine, the everything.
it seems like Mother Nature is still the one in charge.
She has the final say, that's for sure.
What about the doctor shortage?
Yeah, that's a major problem.
How bad is it?
It's really difficult to attract doctors to work in such a remote and challenging environment, And even if you do get them there,
Yeah.
retaining them, keeping them there, that's a whole other hurdle.
I guess not everyone is cut out for life at high altitude.
Not everyone's built for that, no.
It's like trying to staff a research station in Antarctica or something.
Exactly. You need a very particular kind of person.
So even if they build all these incredible facilities,
Yeah.
if there's no one to staff them,
Yeah.
it's kind of pointless.
You need the manpower, right. And that's where the lack of private healthcare makes things even worse.
Right.
There's just very few private hospitals or clinics,
Yeah.
which further limits people's options when they need care.
And it's not just the staff, right? Like from what I'm reading, even getting basic supplies in is a nightmare.
It's a logistical challenge for sure.
Yeah.
Think about it. Almost everything.
Yeah.
Medicines, bandages, surgical equipment, all of it
Yeah.
has to be transported by air.
Yeah.
And air transport is not exactly cheap.
Right.
The costs add up really, really quickly.
So it's not just a healthcare challenge,
Yeah.
it's a logistical nightmare.
Exactly.
And then on top of all of that,
Yeah.
you have this this cultural dimension,
Yeah, that's another layer.
with the Changpa people,
To Chengpa people, yeah.
these nomadic herders
Mhm.
who rely on traditional Amchi medicine.
Yeah. It's a whole other system of healthcare running parallel to modern medicine.
Right. So you have this ancient system of healing
Yeah,
running alongside modern medicine.
right.
How do they interact?
Well, that's the big question, isn't it?
Yeah. Do they clash or do they complement each other?
It's something we'll definitely dive into a bit deeper later on.
Okay. I'm intrigued.
Yeah, it's a fascinating topic.
But before we get to the solutions
Mhm.
and the future of healthcare in Ladakh,
Right.
there's one more challenge we need to talk about:
Yeah.
mental health.
Yeah, mental health. The often overlooked aspect.
The isolation, the harsh environment,
Yeah.
the constant,
The struggle.
struggle for survival.
Yeah, it all takes its toll.
All of that takes a toll on people's mental well-being.
It does.
And these reports are suggesting that conditions like depression and PTSD are pretty prevalent.
Especially amongst the nomadic communities.
And of course, access to mental health care
Oh,
is
even more limited.
even more limited than other types of health care.
Absolutely. It's a real concern.
It's clear that the healthcare situation in Ladakh is
It's complex.
incredibly complex.
Yeah.
And it's got this unique set of challenges that I think most of us can't even fathom.
Most of us sitting in our comfortable homes, we can't even imagine.
Yeah, but what really struck me while reading all this is the sheer determination to overcome these obstacles.
Resilience, yeah.
There's a real sense of resilience
You can feel it in these sources.
that comes through.
Absolutely.
It's really inspiring.
And that's what makes this deep dive so fascinating,
All right.
It's not just about highlighting the problems, but it's about exploring the solutions.
Yeah.
The spirit of collaboration.
Yeah.
The hope that things can and will get better.
Okay, now I'm really ready to hear about these solutions.
All right, let's get to the good stuff.
Give me some hope. What are people doing to turn things around?
Well, for starters, they're getting really creative with public-private partnerships.
Okay.
We're talking about collaborations with institutions like AIIMS, the All India Institute of Medical Sciences,
Right?
and Apollo Hospitals, bringing telemedicine and specialist consultations to even the most remote parts of Ladakh.
So that telemedicine network we were talking about earlier,
Yeah,
that's part of this collaborative effort.
exactly. It's all connected.
It's not just the big hospitals getting involved either, right?
No, not all.
Even corporations are stepping up using their CSR funds
Their corporate social responsibility money.
to make a real difference.
Yeah, they're putting their money where their mouth is.
And they're doing things like mobile health vans.
Mobile health fans, yeah.
Hey, take me a picture.
All right, imagine this. A clinic on wheels,
Okay.
fully equipped with basic medical equipment,
Yeah.
staffed with healthcare professionals,
Right.
traveling to those remote villages
Wow.
that are cut off from traditional healthcare facilities.
It's like a lifeline on wheels.
It is. It is.
That's brilliant. What else are they doing to address the lack of specialists in the region?
Well, hold on to your hats, because this is where it gets really futuristic.
Okay, hit me.
They're exploring AI-driven diagnostics.
AI doctors. Like actual robots?
Not quite robot,
Okay.
but close. We're talking about using artificial intelligence to analyze medical data,
Right.
and assist with diagnoses.
So imagine a small village clinic
Right.
equipped with these AI-powered tools
Yeah.
that can help identify conditions
Yeah.
that would normally require a specialist.
It's like having a whole team of doctors virtually right there in the village.
Okay, now that is some next-level stuff.
It is pretty cutting edge.
But what about AIinHealthcare medicine?
Yeah, the traditional stuff.
How does that fit into this modernizing healthcare landscape?
That's where things get really interesting, because instead of viewing AIinHealthcare medicine and modern medicine as competing forces,
Right.
there's a growing movement to actually integrate them.
So combining the wisdom of ancient healing traditions
Yeah.
with the advancements of modern medicine.
Exactly. It's a really powerful combination.
I know me more.
Well, it's about recognizing the value of both systems.
Right.
And creating a healthcare model that truly works for Ladakh.
Yeah.
Its unique culture and environment.
So it's not just a one-size-fits-all approach.
No, not at all.
It's about tailoring healthcare
Yeah,
to the specific needs of the Ladakhi people.
exactly, exactly.
That makes a lot of
It's
sense.
a very sensible approach.
But let's not sugarcoat things.
Right.
There's still some very real,
Yeah.
very serious challenges
Oh,
facing healthcare in Ladakh.
And one that keeps coming back to me is this question of sustainability.
Okay.
You can build all the fancy hospitals,
Mhm.
roll out all the cutting-edge technology.
Right.
But if it's not sustainable in the long run...
Yeah, it's not a real solution.
Exactly.
It's just a temporary fix.
And sustainability has so many layers, you know? There's the environmental aspect.
Right.
Ladakh is such an ecologically fragile region.
Yeah.
Any development there needs to be done with sensitivity. You
Yeah.
know?
It's like that saying, take only memories, leave only footprints.
Exactly.
You don't want to solve one problem,
Oh.
only to create a whole new set of problems down the line.
Absolutely. And then there's the financial sustainability, too.
Right, because healthcare is expensive,
Oh, it is. No matter where you are.
no matter where you are.
But in a place like Ladakh,
Yeah.
where resources are already so limited,
Yeah.
it's even more crucial to make sure the healthcare system is financially viable,
Right, you don't want to create a system that's,
dependent on outside funding.
right, or that'll collapse as soon as the money runs out.
Exactly. And then there's the social sustainability aspect, too.
Okay.
The system needs to be equitable,
Yeah.
accessible,
Right.
culturally sensitive.
Yeah.
It needs to serve the needs of all Ladakhi people.
It's not just about providing healthcare.
You know,
It's about building a healthy and equitable society.
exactly.
And that requires long-term vision,
Yeah.
commitment,
Collaboration.
and a willingness to adapt and evolve.
Absolutely. And I think that's what makes Ladakh such a fascinating case study.
Yeah.
They're not just trying to solve healthcare problems.
Right.
They're trying to build a better future
Yeah.
for themselves and for generations to come.
It's inspiring, honestly.
It is. It is.
They're facing these challenges
Yeah.
that most of us can't even imagine.
Right.
And yet they're not giving up.
They're pushing forward.
They're innovating, collaborating,
Yeah.
finding solutions that work for them and for their environment.
And speaking of innovation, I can't help but wonder what the future holds.
Yeah. What's next for healthcare in Ladakh?
What breakthroughs are on the horizon?
Right. What new technologies are being developed?
Exciting to think about.
I'm ready for some more sci-fi healthcare scenarios.
All right, let's get into it.
Give me a glimpse into the future. What might healthcare in Ladakh look like in 10, 20 years?
All right, let your imagination run wild for a second.
Okay.
Imagine drone deliveries of medicine.
Drones.
Drones delivering those medical supplies
Wow.
to those remote villages,
Right.
completely bypassing the need for roads.
Drones dropping healthcare packages to people living on mountaintops.
It sounds like something straight out of a futuristic movie, right?
It does, but it's actually happening.
It's closer than you think.
Wow.
There are pilot programs already happening in other parts of the world.
Okay.
And given Ladakh's unique geography,
Yeah.
it's not hard to see how that technology could be a game changer.
Okay. That's pretty mind-blowing.
It is.
But drones aside,
Yeah.
what other futuristic possibilities are we talking about?
Well, one area that's particularly exciting is personalized medicine.
Okay.
Imagine a world where treatments are tailored to your specific genetic makeup,
Oh, wow.
your lifestyle, your environment.
So instead of a one-size-fits-all approach to healthcare,
Right.
it's all about personalized solutions.
Exactly. It's like having a healthcare plan designed specifically for you.
And this is actually something that's being worked on.
Oh, yeah. It's an area of intense research.
Okay.
And as our understanding of genetics and genomics continues to advance,
Yeah.
personalized medicine has the potential to revolutionize healthcare,
Wow.
not just in Ladakh, but globally.
And what about high-altitude medicine?
Yeah, high-altitude medicine.
We talked about how the altitude itself is practically a medical condition in Ladakh.
Right. It's like an added layer of complexity.
Are there any breakthroughs on that front?
Absolutely. Researchers at places like AIIMS, they're doing groundbreaking work in high-altitude medicine,
Okay.
studying the effects of low oxygen levels on the body
Yeah.
and developing new ways to prevent and treat altitude sickness.
So they're not just trying to, catch up with the rest of the world.
Right.
They're pushing the boundaries of medical science
Beyond.
in a field that's directly relevant to their needs.
Exactly. They're turning their challenges into opportunities for innovation.
Which brings us to something that's been on my mind
Yeah.
throughout this whole deep dive.
Okay, what is it?
It's the impact of climate change.
Climate change, yeah.
We know that Ladakh is already experiencing the effects of global warming,
Right.
from melting glaciers to changing weather patterns.
And that's only going to intensify the challenges they're already facing.
Right. Exactly. I mean, access to those remote villages could become even more difficult.
It could.
The risk of natural disasters, that could increase.
Absolutely.
And who knows what kind of new health challenges might emerge.
As the environment changes, yeah.
It's almost like they're fighting a battle on two fronts,
It is. It is.
trying to improve healthcare while simultaneously bracing for the impact of a changing climate.
It's a daunting task, for sure.
But from what we've seen so far,
Yeah.
the Ladakhi people are no strangers to adversity.
They've been adapting to extreme conditions for centuries.
It's like they have resilience built into their DNA.
It's in their blood.
But resilience alone can only take you so far, right?
Right. You need more than just resilience.
What about
Concrete solutions.
yeah, concrete solutions to address the climate change challenge?
That's a great question. And to be honest, I didn't come across anything in these sources
Really?
that specifically addresses climate adaptation strategies.
That's interesting.
It does make you wonder,
It does, because you can't talk about the future of healthcare in Ladakh without acknowledging this
looming threat.
huge factor, yeah.
Yeah, the elephant in the room, or maybe I should say the melting glacier on the mountaintop.
Right, exactly.
It's an interconnected world, and the challenges facing Ladakh are a reminder that we're all in this together.
Well, I don't know about you, but I'm feeling inspired to do some more research on this.
We too.
It's a topic that deserves way more attention than it's getting.
Absolutely.
But before we go down that rabbit hole,
Yeah.
let's shift gears a little bit
Okay.
and talk about the human side of this story.
Yeah, the human side.
Because at the end of the day, healthcare is about people.
It is. It always comes back to the people.
And one of the most important takeaways, I think, from all of this is that healthcare can't be imposed from the outside.
It can't.
It has to come from within the community.
It has to come from within, yeah.
Okay, well, I'm ready to meet the people of Ladakh.
Me too.
Let's hear their stories.
Let's hear it.
So we've talked about the government's efforts,
Right.
the challenges, the tech innovations.
Mm-hmm.
But what about the people at the heart of all of this?
Yeah, the Ladakhi people themselves.
The Ladakhi people.
That's where the story gets really interesting,
right.
You can build all the hospitals and
Yeah.
launch all the telemedicine programs in the world,
Right.
but if they don't actually resonate with the people they're meant to serve,
Right.
it's all for nothing.
It's like trying to force a square peg into a round hole.
Exactly.
We need to understand the culture, the beliefs, the way of life.
And that's where the role of these community health workers comes in.
Okay.
Well, for local people,
Right.
often from those remote villages we've been talking about,
Yeah.
who are trained to provide basic healthcare and education.
Okay, so they're kind of like a
Yeah,
grassroots healthcare movement.
exactly. Empowering the Ladakhi people to take charge of their own well-being.
They're like the bridge between the more formal healthcare system
The official system,
and the communities they come from.
exactly. They speak the language, they understand the customs,
Right.
and they have the trust of the people.
Which is invaluable in a place like Ladakh,
Oh, absolutely.
where
Yeah.
navigating the healthcare system can be so daunting.
Especially for someone who's maybe not familiar with
Right.
how it all works.
I can see how that would make a world of difference.
Oh, it does. It does.
Especially when you're dealing with sensitive issues like mental health, right?
Yeah, things that people might not feel comfortable
Yeah.
talking about with a stranger.
It's easier to open up to someone you know and trust.
Someone who understands your culture.
And it's not just about treating illnesses either, right?
No, not at all.
It's about
Yeah.
promoting overall well-being.
Preventative care. Yeah.
These community health workers are often involved in health education campaigns,
Absolutely.
teaching people about hygiene, nutrition.
Disease prevention, all of that.
So it's a really holistic approach, you know.
Yeah, tackling healthcare from multiple angles.
But how do the Ladakhi people themselves feel about all these changes?
That's a good question.
Are they
Yeah.
embracing modern medicine,
Yeah.
or are they holding on to their traditional practices?
Well, from what I've gathered from these sources, it's not really an either-or situation.
Okay.
It's more of a both-hand approach.
Yeah.
There's a deep respect for Amchi medicine,
Right.
which has been passed down through generations.
Right. We talked about that earlier.
It's that ancient healing system, right?
Yeah.
Based on herbs, natural remedies,
Yeah.
that deep understanding of the body's connection to nature.
And many Ladakhi people still rely on Amchi practitioners
They do.
for those
Yeah.
everyday ailments, preventative care.
Absolutely.
But there's also a recognition
Yeah.
that modern medicine has its place,
It does.
particularly for emergencies.
Right, those acute
And
situations,
complex conditions.
things that require specialized treatment.
So they're not rejecting modern medicine.
No, not at all.
They're integrating it
Yeah.
into their existing healthcare practices.
Precisely. It's about finding that balance.
Yeah.
That sweet spot where tradition and innovation can coexist.
And that's reflected in the government's approach as well.
It is.
They're not trying to
Yeah.
eradicate Amchi medicine.
They're not trying to wipe it out, no.
They're actually exploring ways to formally integrate it.
Bring it into the fold.
Yeah, bring it into the healthcare system.
That's pretty amazing when you think about it.
It is. So instead of seeing it as some relic of the past,
dated.
they're recognizing its potential
Yeah.
to actually enhance modern healthcare.
That's a very progressive approach.
It really is.
And it just makes sense, right?
Yeah.
When you consider that Amchi medicine is so well suited
Right.
to Ladakh's unique environment
Yeah.
and the needs of its people,
It's sustainable.
it is.
It's a form.
structurally relevant.
I love that they're not just trying to,
Copy and paste.
copy and paste healthcare models
From other parts of the world.
from other parts of the world.
They're creating something that's uniquely Ladakhi,
Yeah.
something that honors their heritage
Right.
while still embracing the future.
But let's not sugarcoat things.
Right. There are still challenges.
There are still immense challenges ahead.
Absolutely.
We've talked about the geographical hurdles,
Mhm.
the climate, the doctor shortage.
All that.
But one challenge that keeps coming back to me is this question of sustainability.
Sustainability, yeah.
You can build all the fancy hospitals,
Right.
roll out all the cutting-edge technology.
But if it's not sustainable,
it's not
for
sustainable.
the long run, it's not a real solution.
Exactly. And sustainability has so many layers.
It does. It does.
There's the environmental aspect, of course.
Right.
Ladakh is such an ecologically fragile region.
It is. It is.
And any development needs to be done really carefully.
With sensitivity to the ecosystem.
You don't want to solve one problem
Right.
and then create a whole new set of problems down the line.
Absolutely. And then there's financial sustainability.
Right.
You know, healthcare is expensive no matter where you are.
No matter where you are.
But in a place like Ladakh,
Mhm.
where resources are already stretched so thin,
Yeah.
it's even more crucial to make sure that the healthcare system is financially viable.
You don't want to create a system that's dependent on outside funding.
Right. Or that collapses as soon as the money runs out.
And then you have the social sustainability aspect, too.
Social sustainability, yeah.
The healthcare system needs to be equitable,
Equitable, accessible.
accessible, and culturally sensitive.
Culturally sensitive,
It
yeah.
needs to serve the needs of all Ladakhi people.
Regardless of where they live, their income, their background.
So it's not just about providing healthcare, it's about building a healthy and equitable society.
It's about the bigger picture.
And that requires long-term vision, a commitment to collaboration.
And a willingness to adapt.
And a willingness to adapt and evolve.
And that's what makes Ladakh so fascinating, I think.
Really is.
They're not just trying to solve these immediate healthcare problems. They're trying to build a better future.
For themselves and for generations to come.
It's inspiring.
It really is.
They're facing these immense challenges
Yeah.
that most of us can't even imagine.
And yet they're not giving up.
They're finding solutions that work for their environment.
Yeah.
And speaking of innovation,
Yeah.
I can't help but wonder what the future holds for healthcare in Ladakh.
What's next? What breakthroughs are on the horizon?
Yeah, what new technologies are being developed?
Give me a glimpse into the future. What might healthcare in Ladakh look like 10, 20 years from now?
All right, let your imagination run wild for a minute.
Okay, I'm ready.
Imagine drone deliveries of medicine and medical supplies.
Drones.
Drones delivering those packages right to those remote villages,
Wow.
completely bypassing the need for roads altogether.
So like drones dropping healthcare packages to people
Yeah.
living on mountaintops?
It sounds like something out of a sci-fi movie, doesn't it?
It does. But it's actually a possibility.
It's closer than you think, actually.
Wow.
Pilot programs are already underway in other parts of the world.
Okay.
And given Ladakh's geography, it's not hard to imagine how drone technology could be a game changer there.
Okay. That's pretty mind-blowing.
It is. It is.
Drones aside, what other futuristic possibilities are we talking about?
Well, one area that's particularly exciting is personalized medicine.
Personalized medicine, okay.
Imagine a world where treatments are tailored to your specific genetic makeup,
Oh, wow.
your lifestyle, your environment.
So instead of a one-size-fits-all approach,
Exactly.
it's all about personalized solutions.
It's like having a healthcare plan designed specifically for you.
Okay, and this is something that's actually being worked on.
Oh, absolutely. It's an area of intense research.
Wow.
And as our understanding of genetics and genomics continues to advance, personalized medicine has the potential to revolutionize healthcare.
Wow, that's incredible.
Not just in Ladakh, but globally.
What about high-altitude medicine?
High-altitude medicine, yeah.
We talked about how the altitude itself is practically a medical condition in Ladakh.
Right. It's an added challenge.
Are there any breakthroughs on that front?
There are, actually.
yeah.
Researchers at institutions like AIIMS,
Right.
they're doing some groundbreaking work in high-altitude medicine,
Okay.
studying those effects of low oxygen levels on the body,
Right.
developing new ways to prevent and treat altitude sickness.
So they're not just trying to catch up with the rest of the world.
No, they're pushing the boundaries.
It's pushing the boundaries of medical science.
They are, in a field that's so relevant to their needs.
And then that brings us back to something that's been on my mind this whole time.
Climate change.
Climate change.
That's the big one.
We know that Ladakh is already experiencing those effects of global warming.
Melting glaciers, changing weather patterns.
Yeah, and that's only going to intensify the challenges they're already facing.
Absolutely.
Access to those remote villages is going to become even more difficult.
It could.
The risk of natural disasters could increase.
Right.
And who knows what kind of new health challenges might emerge.
As the environment changes.
It's almost like they're fighting a battle on two fronts.
It's a constant uphill battle.
Trying to improve healthcare while bracing for the impact of a changing climate.
It's a daunting task.
Yeah.
But from what we've seen so far,
Yeah.
the Ladakhi people are no strangers to adversity.
They've been adapting to extreme conditions for centuries.
It's like they have this resilience built into their DNA.
But resilience alone can only take you so far.
You need more than just resilience.
What about concrete solutions to address the climate change challenge?
That's a great question.
Yeah.
And to be honest, I didn't find anything in these sources
Really?
that specifically addressed climate adaptation strategies.
That's interesting.
It does make you wonder.
It does, because you can't talk about the future of healthcare in Ladakh
Right.
without acknowledging this huge factor.
Yeah, it's the elephant in the room.
Right.
Or maybe the melting glacier on the mountaintop.
Right, exactly.
It's an interconnected world, and the challenges facing Ladakh are a reminder that we're all in this together.
Well, I don't know about you, but I'm feeling inspired to do some more research on this.
Me too. It's a topic that deserves way more attention.
Absolutely.
But before we get too deep into that,
Yeah.
let's shift gears a little bit
Okay.
and talk about the human side of all this.
Okay.
Because at the end of the day, healthcare is about people.
It always comes back to the people.
It does.
And I think one of the most important takeaways from all of this
Yeah.
is that healthcare can't be imposed from the outside.
It can't be forced.
It has to come from within the community itself.
It has to come from within.
Okay, I'm ready to meet the people of Ladakh.
Me too. Let's hear their stories.
Okay, so we've covered a ton of ground here.
We have.
From government initiatives and cutting-edge tech
Yeah.
to even like the cultural nuances of Amchi medicine.
Yeah, we've gone deep.
But I keep coming back to something you said earlier,
Yeah.
that healthcare can't be imposed from the outside.
Right. It has to come from within the community itself.
And that's where understanding the Ladakhi people's perspective becomes so crucial.
Absolutely.
How do they feel about all these changes?
Yeah. What are their thoughts?
Are they optimistic, apprehensive? Like, what's the mood?
Well, one thing that really comes through in these sources is this deep sense of resilience
Okay,
and adaptability.
that makes sense.
Ladakhis have been navigating these extreme conditions for centuries,
Yeah.
So change and resourcefulness, they're almost like woven into their culture.
But are they embracing these new technologies?
Sure.
Or are they a bit more hesitant, preferring their traditional ways?
It seems to be a mix, honestly, a very pragmatic one.
Okay.
There's a deep respect for Amchi medicine, which has been their healthcare bedrock for generations.
Yeah.
But there's also this acknowledgement
Okay.
that modern medicine can handle things that Amchi just can't,
Yeah.
like those complex surgeries or emergency care.
So it's not a rejection of the new,
No.
but a smart integration
Yeah.
of what works best from both worlds.
Finding that middle ground.
Kind of like how they've adapted to the environment itself. Right?
Exactly. That blend of old and new. It's even seen at the government level.
Really?
Yeah. They're not trying to replace Amchi medicine.
Okay.
They're actually figuring out how to formally include it within the healthcare system.
Wow.
Recognize its value.
Yeah.
Even train Amchi practitioners alongside modern doctors.
That's a level of cultural sensitivity you don't see everywhere.
It's pretty remarkable.
It's not just about imposing a system.
Right.
It's about understanding what people truly need.
And that's where those community health workers we talked about,
Yeah.
they play such a vital role.
Right, because they're not outsiders coming in with solutions.
No, they're Ladakhis themselves.
Trusted voices.
In their own villages.
Did any of the sources highlight any specific stories
Yeah.
about these workers?
There was one story that really stuck with me
Okay.
about this woman named Sering,
Okay.
who works as a community health worker in a village near Pangong Lake.
Okay, I've heard of that lake.
She goes door to door educating families
Wow.
about basic hygiene, prenatal care, vaccinations.
Mhm.
She even helps organize these mobile health camps,
Okay.
bringing doctors and essential medicines to people who wouldn't otherwise have access.
It's amazing how one person can have such a profound impact.
It is. It is.
She's like a healthcare hero,
A true hero.
but I can't imagine it's an easy job,
Oh, it's not. Not at all.
especially in a place like Ladakh.
She often has to travel long distances, on foot, horseback, facing harsh weather, challenging terrain.
Right, it's not for the faint of heart.
But she's incredibly dedicated,
Yeah,
driven by this deep sense of responsibility towards her community.
that's really inspiring.
It is.
Her story really highlights the human element of all of this.
He does. Sure.
At the heart of healthcare in Ladakh.
Yeah.
It's not just about technology or infrastructure.
It's about the people.
It's about people caring for each other,
Yeah.
supporting each other,
Working together.
working together to overcome these challenges.
And it's a reminder that healthcare isn't just about treating illnesses.
Right.
It's about empowering people,
Yeah.
building healthier communities,
Right.
creating a more sustainable future.
We've covered so much in this deep dive.
We have.
From the challenges of the geography and the climate
To the innovative solutions.
to the solutions being implemented.
It's been a journey.
But if there's one thing I'm taking away from this, it's this sense of awe at the resilience of the Ladakhi people,
Oh, absolutely.
their ability to adapt, to innovate, to persevere.
It's remarkable.
It's truly remarkable.
It is.
And it makes you realize that even in the most remote corners of the world,
Yeah.
there's so much we can learn.
So much to learn from each other.
Absolutely.
And for you listening, this isn't just some far-off story, what's happening in Ladakh.
Yeah.
It has implications for us all.
It shows how interconnected we are,
It does.
how climate change is impacting everyone,
Yeah.
and how important it is
Yeah?
to find these sustainable and equitable solutions to these global healthcare challenges.
They're all in this together.
It's a call to action, really.
It is.
To learn from Ladakh, to support the work being done there.
To be inspired by their spirit.
And maybe, just maybe,
Yeah.
to realize that the answers to some of our biggest challenges.
Might be found in the most unexpected places.
Exactly.
Until next time, keep exploring, keep questioning, and keep diving deep.
And that's our deep dive into healthcare in Ladakh.
Ladakh, what a place.